this week on the BackTable podcast.
We're so busy teaching the practice of medicine that we miss the business of medicine sometimes. And I think that that's something that we all should really be more focused on going forward, because I think unfortunately, has become a critical part of being successful, however you want to define that. In your practices, I think we're all being judged by productivity measures, and to a certain extent that your productivity is based on how cleverly you can bill.
Hello, everyone. This is Gina Badalato opening up our next Resident BackTable series focused on issues pertinent to graduate medical training. Unfortunately, my co-host Lindsay Hampson couldn't join us tonight, but I'm really fortunate to have two wonderful guests with me, Dr. Amanda North and Dr. Jennifer Nauheim. I'm going to have them each introduce themselves, starting with Dr. North. Tell us about yourself.
Hello, I'm Dr. Amanda North. I am a professor of urology at the Children's Hospital at Montefiore, where I'm also the division chief of pediatric urology. And as my side job, I'm the chair of the AUA Data Committee. And so we've done a lot of work on burnout, both in practicing urologists and also in trainees.
Awesome. And Dr. Nauheim?
Hi, my name is Dr. Nauheim. I am a new clinical assistant professor of urology at NYU. I just moved to Brooklyn, where I've been working. I also very recently graduated from Montefiore, where I worked with Dr. North, and we did some publications on burnout in urology. So it's a topic that is near and dear to my heart.
So we are reuniting our mentor-mentee training pairing here tonight with some experts to really shed some light on this important issue of burnout and wellness during residency. These are very common buzzwords, but I think that, as Dr. North pointed out, as recent chair of the data committee, she has a lot of data surrounding this and a lot of granular information that can inform this topic. So, Dr. North, can you tell us a little bit more about your prior work on burnout with the AUA Residents and Fellows Census?
Yeah, absolutely. So most people think of the AUA Census as being the census for practicing urologists, but we've actually published 3 census publications looking at urology trainees. The most recent was published using data from 2020 and 2021. We had a prior publication from 2019, and then a publication that included all prior censuses before that into one publication. For those who are interested in looking at the data themselves, this is all available for free on the AUA website if you're a member, so feel free to take a look at these publications. We have looked at 2 different time periods of AUA census data for our trainees. We published back in 2021, looking at the data from the 2019 census, and then more recently, earlier this year, the data that came out on the more recent resident and fellow census. Interestingly, when we look at burnout rates overall among residents, although it's unbelievably high at 47% in 2021, and then in the more recent publication, 48%, so that's nearly half of our trainees experiencing burnout. We fortunately did not see an increase in burnout over those 2 time periods. So that's some good news. The other good news is, unlike our recent publication from the Practicing Urology Census, where we saw a tremendous increase in burnout among women, we have not seen this among our trainees. So there's no difference in burnout rates between men and women who are training in urology. And I think that that's a little bit of good news. I'd be happy to talk a little bit more in granular detail about some of the factors that seem to contribute to and protect against burnout, but I don't know if Dr. Nauheim wants to chime in at all on what we've had to say so far.
No, Doctor, everything you said, is very interesting. And the data, I think, how the differences between men and women and how it's not, impacting female trainees more than male trainees, I think is important. I did see something about how female trainees might have been more predisposed to burnout if they experienced anxiety in medical school, which I thought was also very interesting. But I think as far as, things that protect towards burnout or, encourage burnout, I think is something I'm happy to dive deeper into. If Dr. North, if you want to take the lead, and I can speak more to that as well.
Absolutely. So I want to start by saying that there was a pretty good study that came out in the Gold Journal before we published any census data on burnout. And one of the things that publication stated was that residency programs that have their residents working more than the ACGME approved 80 hours a week had higher burnout rates. And
that should not be happening.
Well, and that's the point. So it's really interesting that you'll see not just that, if there's no access to mental health services, that increased burnout, right? Another thing that's required by the ACGME. Interestingly, that paper found that having a structured mentorship program was protective, and, the converse, not having a structured mentorship program promoted burnout. So residency programs that don't care about the rules have residents who are more burned out. And that data goes back to 2019, like I said. What was really interesting in that paper is they found that spending time with family and friends, so scheduling time with the people you love, is really important to protect against burnout. And the other interesting thing they found, which is sort of random, is that reading for pleasure, so not reading Campbell's Urology, not reviewing guidelines, not doing your practice exams for the in-service,
wait, hold on. Dr. North, you don't read Campbell's Urology for pleasure?
Well, yes, of course I do. No. No, I read fiction for pleasure. Thanks for asking. But actually reading for enjoyment was protective against burnout. And I don't know why they thought to ask that question, but I found it really interesting that taking time with people you love or taking time to take a break from it all by reading for fun seemed to be really protective. So I thought that was really interesting data, not from a paper I wrote, but from a paper that I think started the trend of looking at burnout in urology.
Awesome. Yeah, and it substantiates some of the rules and regulations that the ACGME monitors. And it supports this idea of flexibility, flexibility to spend time with your family or do things for pleasure, things that make you whole.
Just some other interesting, papers on burnout and for residencies and things that are protective. There was one study out of Robert Wood Johnson where they basically looked at resident wellness. And one thing that they found was basically the two things that were protective or, beneficial toward resident wellness were having resident wellness funds where residents would have, social events together and social gatherings, and also residents being able to go to their own doctor's appointments, which makes sense that, if you're able to seek the medical care that you need, that it would make you a better doctor for others. But that's something that we even had within our own program. We had a resident wellness fund, and that's something, I always encouraged as a resident, as the unofficial social chair of my residency, to make sure that we spend a lot of time together outside of work. And this was something that we found was really good mentally for us as residents. And it's nice to know that there's literature out there to back up kind of what I had been doing unofficially for all those years.
Validating for sure. Dr. North, if we turn back to you, you alluded to the most recent census data, which was published in the Journal of Urology a couple of months ago. How do these recent trends compare to some of these prior studies that we've been citing and prior themes that have been noted?
So just to back up what Dr. Nauheim just said, in both of the census papers that we've published, we found that one of the key things that residents want is the ability to attend medical and dental appointments. I know, God forbid, that we take care of ourselves as doctors, but it's actually really important to wellness and to a feeling of control over your environment, right? I think one of the things that really drives burnout is a lack of autonomy, and no one suffers from that more than residents, right? Where they have very little control over their schedules. But to be able to know that if you have a dentist appointment, you can actually go, to be able to know that if you have a therapy appointment, again, God forbid you take care of your mental well-being, you can actually go, that came up as one of the very key components of what residents want on both census papers. And so to back up the study that Dr. Nauheim was mentioning, in these large census studies, we found that also. I want to make an important point about resident burnout. We know from almost every study of urology residents that our PGY2 residents have the highest rates of burnout. That's been consistent. When we look at studies that look at all residents, not just urology residents, a lot of them studied PGY2 residents. Now, remember, in pediatrics and internal medicine, that's the middle year, so it kind of makes sense. In urology, most programs are pretty pyramidal in terms of call burden being, the highest in the bottom and the lowest at the top. And so it's not surprising that our PGY2 residents are suffering the most. But consistently in every study, that's the year we really need to be careful about, and that's the year that we really need to support. I don't know that we're going to change the call structure in most of our programs, right? I mean, I don't even think the PGY2s want that, right? They want the ability to graduate to less call. That's something they look forward to. But I think understanding what a stressful year PGY2 year is for urologists is really important for not just program directors. Of course, it should be important to program directors, but to anyone who's working with residents in any capacity to offer that extra layer of support in that second year of residency, because our residents really struggle more than in other specialties. That's the year that we're seeing a lot of trouble.
Yeah, that totally makes sense. And I remember you highlighting that in another talk I'd heard you give. And it's so true because of the work hours, the demands. I think that's the year that they're highest at risk for attrition also. So from a mental health and for, preserving the workforce and, their professional future, it's really important to give that support, keep all these things in mind. And as you're saying, so there's evidence that after that critical year that people rebound and that their burnout scores improve after that towards chief residency.
So interestingly, in the most recent study, the chief residents had a slight bump in their burnout compared to earlier. I don't know if it was a statistical blip or something we need to keep an eye on, but the PG4 residents were the ones who were doing the best. I do think being a chief resident is a different level of responsibility, right? So it could be that that's wearing on some of our residents, but we definitely see a sharp drop from PGY2 to PGY3, with PGY4 residents having the lowest burnout scores of all. Yay to be a PGY4. And then in the most recent study, we didn't see this earlier, a little bump for the chief residents, nowhere near the level of our PGY2s though.
Maybe we can ask Dr. Nauheim, having recently finished her chief year, what do you think explains that blip that Dr. North's talking about?
So it does make sense to me. Having recently gone through everything myself, PGY4 year was definitely the best year because you're kind of out of the junior call pool. You're not quite taking on the responsibilities of a chief resident yet. And when you're a chief, you kind of take ownership for your service, for all of the residents. It's your pre-attending year. So, and obviously now as the attending myself, it's not quite at that level of responsibility, but the way that our chief year was structured, there's, a lot more responsibility and a lot more falls on your shoulder, and, you're the chief. So I could see how that would contribute to a little bit more burnout.
And what are things that you think are important for a chief resident from that standpoint to support the PGY2s and the more junior residents? So we've got the faculty looking out for them, thinking about them, checking in, but what can their peers and their senior colleagues do?
So I think it's always important to check in on your juniors. You know which are the ones that are suffering. You know who's kind of at that highest risk for burnout. And it's just important to make sure that you're doing check-ins with your residents. When I was a fourth-year medical student, I went to a general surgery session for rising interns. And the advice that I was given as a fourth-year medical student was, don't complain up. Nobody wants to hear it. The more senior people have been through it. And if you want to complain, you can complain laterally or you can complain down. But that's just not something that I ever personally agreed with. So then when I was the most senior person, I encouraged my juniors to complain to me. I wanted it to be kind of an open forum for discussion. Grab a cup of coffee, take moments in between cases, just say, hey, what's bothering you? Like, this is an open forum. You can vent, because sometimes even if I can't change, the amount of call that they're taking, even if I can't change that the ED is going to call them for every clogged SP tube that comes in, I can at least let them vent. And sometimes just talking about it can make you feel so much better. And to me, it was very important just to have that open dialogue.
That's great. I think that's important to have that relationship with your senior residents who are really role models for the junior residents, and having that open door policy to kind of, we used to call it, venting. That's definitely important. I want to go back to something Dr. North mentioned in terms of trends with women and female residents having higher, or historically having higher rates of burnout, but not necessarily substantiated in the more recent data. What was contributing to that, and why do you think that maybe it's gotten a bit better?
Well, the percentage of women who are going into urology has increased over time, right? I'm old. Back when I trained, there were not a lot of women. Thank you. Well, thank you. But back when I trained, there were not a lot of women to look up to. There weren't role models. And I remember being junior faculty. I was the only woman on faculty at Montefiore at the time. And all of the men in my department, they were very nice to me. I can't say otherwise, but they either didn't have children or their wives were stay-at-home moms, like universally. And, I was married to someone who worked full-time also, and I started off my career with children. So, I was kind of trying to figure out the whole deal with no female mentorship, no role models, no one to help me figure out how to manage a complicated home life with a complicated work life. And that's really changed a lot. I think there are no longer a lot of academic programs without women on faculty, right? So I think most of our women residents now have women senior to them to look up to speak to, vent to. I think, and I talk about this a lot. I've been in practice for over 17 years now. I'm the division chief. I finally got promoted to full professor.
Congratulations.
Thank you. I still get asked if I'm the nurse regularly at an institution that I've spent my entire career working for. And it's really exhausting. And our residents have the same issues, right? Are you the PA? Are you the nurse? Are, whatever it is that's not the doctor or the surgeon. But having women who are also experiencing it at a more senior level to find the humor in it, right? Or to learn what an appropriate response would be. And, there's always that the women residents get in more trouble for speaking the same way that a man could say without getting in trouble, right? There's that sense that there's a little bit of, inequality there still. There's definitely a little bit of inequality there still. But knowing that there are people who have been there to defend you, about a third of urology residents are now women, right? As we move forward where there are more women in the field, we got each other's backs. And if I'm going to give one little bit of advice, it is to have each other's backs, because we know that doesn't always happen. But I think that we're moving towards a place where we understand where some of this is coming from, and we know what's noise and what's real.
So true. I think it ties in nicely with what you were saying before about the importance of even mentorship. And, concordance in some cases of mentorship can be valuable and protective and burnout in certain at-risk or historically vulnerable populations. And I think definitely those stories are so poignant and kind of ring true. And you think about having role models and mentors and the importance of that during these critical moments in your training in your life when kind of you're at your wit's end, you're tired, and having that mutual understanding is just so important. Dr. Nauheim, you talked a little bit about being the social chair and some of the programs that you had at Montefiore, including a wellness fund that was dedicated towards these types of events. Can you talk a little bit more about the functions that you organized and how, any advice you could give on how such a fund could be accrued? I don't know if you have that information, or maybe Dr. North could weigh in on that.
The fund was actually already in place when I started my residency, and I, attribute that to Dr. North, who, when I first started in residency, would have wellness events with all the residents where, we would go out to the local breweries. And it was just a nice, especially for me as an intern, a great way to meet, a faculty member, see someone outside of work. And that was really enjoyable. When I started organizing things myself, there were a couple events that I would try to host every year. Every year I would have an event for the incoming interns before they started to make sure that they could, usually it would be in my apartment or someone's apartment off campus, so the interns could see what they're kind of getting themselves into in a good way. This is going to be your new family. I always tried to have an I Survived July gathering, as close to the end of July or beginning of August as possible, just, to once again, say, you did it, you made it through that first month. And, once again, here we all are, celebrating together. And then I just think the important thing is just to hang out as often as you can. Residency is crazy. Everyone's busy. The juniors feel like they're always on call. Not everyone can come to everything, but the more times that you all spend time outside of work together, the more opportunities that you'll have to be together. And I think that's so important because it reminds you and yourselves basically that you're not just residents, but you're people. sometimes I feel like you really lose yourselves in the hallways walking around in those late hours, and it's important to just be together and enjoy each other. And I think that was very helpful.
I think one of the things that's different about being a resident from being an attending is how much you rely on each other to get the work done when you're a resident. And I think one of the things that was sort of challenging when you become an attending is you don't have that anymore, right? The patients are kind of yours rather than the team's. And what's so interesting about this is that when hospitals try to do wellness events for faculty, like pizza parties and stuff, they're seen as being dismissive of the problem of burnout because it's felt like they're trying to throw pizza at us instead of fixing the frustrations that make our day-to-day work so challenging. What I really need is not pizza. What I really need is an extra nurse to help me with my MyChart inbox, right? Like, save the pizza money, get me a nurse. But as a resident, because it's so much teamwork, I do think that these bonding experiences outside of work actually play a more important role than maybe we realize as faculty, because that's not necessarily what the faculty wants. And so I think Dr. Nauheim brings up a really good, really important point about the value of that. It's easy, I think, for us, to look back and be dismissive of the importance of that, because I know, Dr. Badalato, you and I both have kids at home and, these busy, busy lives, and the idea of having another work event to go to after hours kind of makes me want to roll my eyes. But on the other hand, I think when you're working as a team the way residents do, that those bonding experiences help enhance the teamwork and make the job more fun in the long run. And I think that that's a really valuable lesson for us to all remember.
I think that's so true. And really comparing the team dynamic, the camaraderie during residency and then attendinghood, it's lonelier. And I think that's part of the challenge, and that's part of the unique aspects of burnout for faculty, not having that group that you're talking about kind of cultivating there, Dr. Nauheim. You spoke about it. So some residents may be listening to this podcast, and some may come from programs that have wellness that the faculty are helping to kind of orchestrate these events, and some may not have that infrastructure to their programs. What advice would you give to a resident who's looking to start that type of culture? How would someone go about creating a family out of a group of residents the way you've described?
I would say, I guess, start to be okay with a little bit of rejection and to not take it personally, because you as a resident yourself know just how busy everyone can be. And sometimes doing extra things feels like a lot of extra work. But for me, I just kept trying. I just keep saying, okay, what day works for everyone? Where should we go? Just trying to find something that's accommodating to people. Maybe if it's not the most fun place to go, but pick something closer to the hospital, if it could just be more accommodating to people. But keep asking and keep trying. And even if you don't have a fund, reach out to your program director, reach out to, the ACGME and see if it would be possible to get a little bit of a resident wellness fund. But even if not, it doesn't really cost anything to all get together and, have a board game night. Maybe everybody chips in a little bit to, pick up some sodas and snacks. But I think it's just about trying and persevering, because I know for me, when I would try to organize the residents, there would be so many times I would send a text in the group chat and everybody ignores me. And I don't take it personally. I just keep trying, because the more you try, the more likely you are to get everyone together. And that's just, I think, the best way of going about it is just to try again.
Put out that intention. Welcome the little things. It doesn't have to be something grandiose, but it's the community aspect of it, as you're saying. I want to talk a little bit about a transition that Dr. North was alluding to, about the differences between resident and faculty. And I know that the Young Urologist Committee is focused on this to some degree in their manual, thinking about the transition to practice. And you've actually, again, just underwent this transition, Dr. Nauheim. What is your sense of how resident and attending stressors are the same or different? And what are we missing in terms of preparing residents for that transition? So Maybe I'll start with you, Dr. Nauheim, since this is probably very real for you right now.
Yeah, it's hitting really close to home. It's very interesting how quickly the things that you cared so much about as a resident completely shift once you become an attending. It's almost like in The Wizard of Oz when she lands in Oz and everything is suddenly in color, and my concerns are just completely different. My stressors are completely different. I'm not as concerned about call. Now I'm more concerned about my in-basket and how frequently I should be checking it. And how come even though I just cleared all my results 2 minutes ago, suddenly they're full again. So these are kind of my new concerns and my new normal structuring, how to get through my clinic day. When Dr. North, you mentioned the isolation of being an attending, that's something that's unique because, you don't have like that given group. I'm very lucky in my new job though, because the same way that, I would help to organize resident hangouts, I'm trying to organize faculty hangouts.
Oh, I love that.
I've actually already gotten together with some of the other faculty members in my department. And, that's been really helpful. And I'm, once again, trying to get some faculty members together again. Once again, trying because everyone's super busy. And I understand that. But I was sitting in a room with some other young attendings recently. We were all kind of voicing how isolating it can feel at times. And it is nice to be able to get together outside of work and have a night together just to talk about either work or not work. The stressors are certainly very different.
Do you want to weigh in, Dr. North, and also specifically touch on what do you think we can do to prepare residents to address some of these challenges?
I think Dr. Nauheim brings up a really good point about inbox management, right? That's not something that we really teach residents. When I have residents rotate with me through clinic, I try to go through the billing aspects of clinic and why we have to document certain things, certain ways to justify certain billing codes, right? And the importance of that. And I think collectively we do a poor job of teaching that. And I think historically, those of us in academic medicine tried to exclude ourselves from having to understand coding and billing to the same extent as our private practice colleagues. And that's just no longer the case, right? It matters for us every bit as much as it does for people who are in private practice. And when we're not really teaching the specifics of why we document in certain ways and how we determine billing levels and the importance of different things that we do in our clinics and in the operating room too, right? And really explaining that documentation and billing component. We're so busy teaching the practice of medicine that we miss the business of medicine sometimes. And I think that that's something that we all should really be more focused on going forward, because I think unfortunately has become a critical part of being successful, however you want to define that, in your practices. I think we're all being judged by productivity measures, and to a certain extent that your productivity is based on how cleverly you can bill.
Yes, that whole kind of hidden curriculum was something we tried to touch on in the New York Section Empire series, and Dr. Hampson as part of her COVID lecture series, and trying to get a little bit more formal education on that aspect, that non-clinical aspect of that business aspect of practice, which arguably we need to do a better job of preparing our residents for. Now that I have you, Dr. North, I think it's a good opportunity maybe for you to talk a little bit about the resident census, maybe a little bit more, not what types of questions are on that census, not just burnout, but the scope of it, why it's important for residents to participate, and when they can expect the next census. I know that this was recently completed, but please tell the residents a little bit more about that.
Thank you, Dr. Badalato, for letting me talk about my favorite topic, which is the AUA Census. So I'll talk about the resident census. I want to point out that there are multiple censuses. Like I said before, there's a practicing attending census that Dr. Nauheim can now participate in. There is a resident and fellow census that gets published every 2 years, so not annually, although the questions are asked annually. There's an APP census, so we ask our advanced practice providers in urology, and we're starting to move towards studying medical students who are interested in urology as well as practice managers. There's also an international urologist census that gets published. So the census opens every year at the annual meeting, and then it closes on September 30th. And the resident committee participates largely in doing the questions for the resident census. A lot of the questions are the same year to year, but we do try to add on some questions. A full disclosure, Dr. Badalato and I are currently working on a paper looking at parental leave and the changes in parental leave in residency since the American Board of Urology changed some of the rules on sitting for your written boards. And interesting question came up today in our project looking at how many residents have to take makeup call if they take parental leave. So that's kind of an interesting little topic that hopefully will be published at some time next year. But, so we look at parental leave. We look at the access to breastfeeding facilities for women residents who have babies during residency. There was recently a whole bunch of questions asked about patient harassment of providers, and that was put on all of our various censuses, not just one, because we thought it was such an important question that we wanted to ask everyone. I have not seen the data for that yet because that won't get published until next year. But that'll be a really interesting topic to look at. We look at what people think their salaries are going to be when they finish. We've written a paper looking at the impact of student loan debt on whether or not residents want to do fellowships and where they choose to practice. We look at exposure to rural urology because we know that there's a huge workforce shortage getting worse by the year, but it's especially severe in rural areas where 60% of counties in the U.S. have no practicing urologists. So understanding would student loan debt forgiveness programs help encourage residents to go practice in rural areas? That's a bill that we've been trying to get through Congress. So understanding if it would be effective is part of what we're asking on the census. So we're really interested in understanding what impacts where residents end up in the long run and how that decision-making plays out. So every year you're going to get a census. Please, please, please take the time to fill it out. The nice thing about the census, if you've ever filled it out before, your demographic information should auto-populate, so it's not as burdensome the second time you fill it out, so just keep that in mind. We really do try to limit the questions so it's not super time-consuming, and we're starting the process of soliciting questions for next year's census already. So if people have topics that they're really interested in, please reach out and we'll see what we can do. No promises, of course, but we do actually solicit topics from various groups with affiliations with urology, whether it's the sections or like the SUO, the SPU, SWU, all the various stakeholders. We do ask them for questions. And so if people have questions that they think should be put on the resident and fellow census, like Dr. Badalato is also on the data committee, so you can reach out to us and we'd be happy to at least, present them to the team to see if they're feasible.
Awesome. I'm so glad that the audience could hear about it because all of those topics that you mentioned, parental leave, debt, income, harassment, these all are, overlap with this topic of wellness. And so this is a really unique opportunity where residents have a voice, where we can study these things that impact residents and fellows. It's a unique survey focused on that and really can help inform training going forward. So it's so important for people to be aware that exists, to look at the archives, look at some of the research output from the data committee, and participate in ongoing censuses. The time has flown by here. I think we covered so many great topics about the risk of junior residents, PGY 2-year, and how, there may be an increased risk as people think about ending their residency of burnout, how these are multifactorial, have to do with call schedule, time for medical appointments, time with family, access to mental health and work hours, and really what can be done, as Dr. Nauheim has highlighted, on a resident level to help your peers and organize more of like a community feel to your residency to help combat some of these stressors. I wanted to give you each an opportunity to get any closing words that you want our listening audience to kind of take home from this episode based on your work and experience, extensive experience in wellness and burnout during residency. We'll start with you, Dr. North.
My take-home message, aside from please fill out your AUA census, is that it's really all of our responsibility to have a healthy residency workforce, right? Our residents are our greatest assets. They are our future. They are the ones who are going to allow us all to retire someday. And so it's in everybody's best interest that not only that we have well-trained residents, I mean, that goes without saying, but that we have healthy, well-trained residents. We have well-trained residents who have the enthusiasm and energy to go into the workforce. This I was beaten down, so you should be beaten down mentality, that just doesn't fly anymore. And so let's put that aside. Just because, you worked 55 straight hours with no lunch, whatever, get over it. We need to treat our residents properly. We need to provide them with the resources they need to be full human beings, right? It's time that we put all of that old thinking about what training should be like aside and think about how we can help residents be the best that they can be in every possible way. And I really think it's on every single one of us. I mean, whether you're in academics and you're working with residents every day, or you're in private practice and you want to retire someday, these are the people who are going to allow that to happen. And so providing a great environment for them to thrive is up to all of us.
Well said. Dr. Nauheim, parting words?
Yeah, so Dr. North, that was beautifully put. I think just my message to the residents, I guess, to the juniors, just know that, as you move through it, things will continue to get better. But if you ever feel like you need to reach out to someone, just know that you're never alone. There's always someone to talk to. Another junior resident, and maybe your chief, another senior resident, a faculty member. It's very important that if you're struggling, that you find someone to talk to. And to the senior residents, if you see that one of your juniors is struggling, just make sure that you reach out, talk to them, take some time, grab a cup of coffee, get a smoothie. Just make sure that you make time, because sometimes it feels hard to make time, but those 5 minutes can make all the difference.
And I think with that message, we'll conclude this episode. I want to thank Dr. Nauheim, Dr. North for their time, for their valuable insights. And I think that this episode will be a great resource for both faculty and residents moving forward. So thank you both for your time, and thank you to our audience for joining. Have a great day.
Thank you so much for listening. If you haven't already, make sure to follow, rate the podcast 5 stars, and share with a friend.
If you have any questions or comments, you can direct message us at _BackTable Uro on Instagram, X, or LinkedIn.
BackTable is hosted by Aditya Bagrodia
and Jose Silva.
Our audio team is led by Kieran Gannon, with support from
Aaron Bowles,
Josh McWhirter,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Judy Dela Cruz.
Thanks again for listening, and see you next week.